Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders from across the industry. I'm Maria Castellucci, a custom content strategist at Modern Healthcare. On today's episode, I'm thrilled we're featuring Annette Walker, president of City of Hope, Orange County. Annette Walker has gained a national reputation for her industry-changing insights, outstanding leadership, and keen abilities to bring people together and achieve extraordinary results. Twice recognized by Modern Healthcare as one of the most influential leaders in healthcare, Annette has been at the helm of many top organizations in her field. She considers her leadership at City of Hope among her most important roles as she is developing a cancer campus and network of care that will transform the Orange County, California region, home to 3.2 million people. This year, Annette and her team will fulfill the promise of Orange County to build a leaner foundation cancer center in Irvine, California, in Orange County's only cancer specialty hospital. This cancer campus will disrupt traditional models for academic medicine by speeding highly specialized care to the heart of the community. Annette has also established a network of clinical locations that brings life-saving services even closer to those who need it. Annette says her proudest achievement is partnering with her husband Chuck to raise a close family of 6 that now includes 13 grandchildren. Annette, thank you so much for being here today. I look forward to our conversation.
Thank you so much for having me.
Okay, so to dive in, we should talk about the pandemic. We're now 2 years into the COVID-19 pandemic. Can you talk about what we can learn from the way the industry responded to this crisis?
You know, I think already we're looking back a little bit and thinking these are the worst of times and the best of times. So I think everybody already knows what the worst of times were. So I want to talk a little bit about what I think were the best of times. I've been in healthcare for 40 years, and I have truly never witnessed the American healthcare system like so focused and so laserly pointed at trying to fix the problem in healthcare. So in this case, it was COVID-19. So think about that. In those last 2 years, what did we do different? Well, first of all, as an industry, you see unprecedented cooperation, not only between providers in a community. So like, how are all the local hospitals working together? Unprecedented cooperation. And then with that, you have unprecedented participation by the leaders in business, by city officials. I mean, the vaccination sites that popped up in civic centers or parks, that was done with the cooperation of cities. We had emergency providers cooperating. We had pharmaceutical companies cooperating. We had government agencies cooperating. So think about that. So unfortunately, we lost about 1 million people in the last 2 years to COVID. Every year, we lose 8 or 900,000 to heart disease. What if we, as an industry, did and went after heart disease the way we went after COVID? I think it would be just amazing what we could talk about. The news agencies telling people all the things they need to do to stay heart healthy. We try to attack this from our point of view. So most healthcare organizations, like the ones I've worked for my whole career, we look at our PSAs and say, how can we make a difference in our PSAs? And that is good and worthy work and important. But how different might it be if, for instance, in Orange County, every healthcare provider said, hey, let's all look at this together. What can you do? What can I do? How do we work with our businesses to be different? So this is what I hope we don't lose, Maria. We had a lesson in front of us, and we changed the way we operate. And I just get so worried that, oh my gosh, are we going to slip back? Are we going to forget the lessons of COVID and not try to apply them to the real issues our country has in healthcare?
So that brings us to my next question, which is you talked about heart disease. How can that speed and focus be adapted to other things, other diseases like cancer?
Well, I'll use City of Hope coming to Orange County as an example. We're an academic institution. So what does that mean and how does it make us different? We have 400 specialists that do only cancer, and we have 800 scientists who do cancer research, and we have about 1,000 clinical trials. That's an amazing arsenal against cancer. But why should access to all that intellectual capital be confined to only those people who can make the trek to the academic medical center? Our CEO has talked about this, and he uses a term that I love. It's the democratization of specialized cancer care. So as we're coming into Orange County, it's something that we have said from the very beginning, but means even more to me now. When you talk about who the competition is cancer. That's, and we want to work with anybody in Orange County who wants to beat cancer. And when I think about who those people are, they're all the societies that are dedicated, like American Cancer Society, Susan Komen. It's the other community providers, the other hospitals in the community. It's the schools, it's the groups, the community groups, it's the cities. What could we do differently? And my team and I, we're just really trying to see if can we land City of Hope in Orange County in a different way? Can we be participants in this community differently? And can we open up that intellectual capital, which as a not-for-profit is legitimately owned by the community, not by just an organization, and try to change how cancer care might be delivered in Orange County and increase access to specialty care as well as clinical trials.
Wow, that line, the competition is cancer. I love that. That definitely is something to keep in mind. So, what does the healthcare industry need to do better and more of?
Well, I think better and more of is listening to our patients. But like right now, I think my song here, or my soapbox today, is extend our hands to other providers in the community, and let's see how we can better tackle this. I also think extending it to city and county officials. I mean, you saw what a really aggressive role they took in public health during COVID. In general, they tend to be quieter. And so trying to work with them on whatever the really significant health issues of your community might be. Obesity is at 42%. 1 in 3 people have diabetes. Heart disease is a leading cause of death. Cancer is, because many of our populations are aging, cancer diagnoses are going up. How do we try to be more proactive on prevention? And then working with our legislators, we've given, as a country, we give a lot of lip service to prevention, but we spend all our money on treatment. So it's like, think again of COVID. What did we do to try to prevent the transmission of COVID? Well, what are we doing with all those parties to prevent the increase in diabetes? What about our food supply chain and things like that? Those are the things that, as not-for-profit providers, we do not have a lot of influence unless we try to lock arms with other people in our community and create influence. So that's how I think it is done. And I think it's done collectively. I don't think it's done individually as organizations, although I do believe individuals can make a difference. I don't think the healthcare in this country will change unless we get people to act like we did in COVID.
So you've been talking about competition. So healthcare is very competitive. So what can providers do to help in this area?
Well, I think everybody is doing right now the best that they know to do to provide for their organization, ensure their organization's future. I think maybe perhaps it needs to start at another level with government and how organizations are reimbursed, and how we're not just maybe not reimbursed individually, but how we're reimbursed collectively for large swaths of our community. We get, again, still we're reimbursed on procedures generally, or those kinds of things. But if, for instance, there were changes and all of a sudden all of us are going to be reimbursed for how we actually impact diabetes in Orange County, well, that would get a lot of attention. Mm-hmm. And I think these kinds of actions need to be led by people like us. We do know how to do it, but we don't know how to do it alone. Nobody has enough to do it alone. That's so. If my lasting message is, can we as leaders in healthcare begin to look collectively how we create a healthcare system for this next generation that is more sustainable and more effective?
Right. You talk about not being able to do it alone. So, collaboration in healthcare is so important. And during the pandemic, we saw so much collaboration. So, can you talk about community collaboration, how important it is, and when it comes to delivering the best healthcare?
Yeah, I think it's extremely important. And again, I'm going to go back to COVID. I was listening to the mayor of Irvine, which is a big city by us today, and how they got all in on it, and how healthcare is very important to the civic leaders in our communities. They're concerned about not only the physical health, they're concerned about the mental health, they're concerned about environmental issues. They are concerned about how we're polluting the environment or not polluting the environment. These are all great opportunities to lock arms with civic leaders who have these same concerns as we do. And just, some cities are creating or convening groups, more diverse, meaning that they're not just from certain aspects. They're diverse not only in reflecting the community's population, but diverse in the kind of organizations that they're inviting to the table. And I think as healthcare leaders, we should be all in on that. We should be all in on helping them plan our services. We tend to participate, but we do our planning based from our statistics of how many people live in this area, have this or that and the other thing, how many live in our zip codes. How could we develop a program for those in our zip codes, and then we go market it. But we still do it pretty much in isolation, as opposed to, what if everybody did it together, and we did it with the city leaders and we did it with the business leaders. I think the business leaders are a significantly untapped resource. They pay a lot of the healthcare bill, and they have a lot of incentive to be part of this in all the aspects that affect health in our communities, particularly education and education and income. And they're both related, and those both have a direct impact on health. So this is such a complex thing, but we've been talking about this for as long as I've been in healthcare. And we have done good things, but I think COVID gave us a glimpse of how different it might be if we did it differently.
Yeah. Okay. So, to end our conversation, this has been great. So many great insights from you, Annette. Let's talk about transformational leadership. So, healthcare has gone through so much transformation and change recently, especially due to COVID. What leadership skills do you think are needed to achieve total transformation?
Well, the first one is courage. And the second one might be, what word do I use? Other directed. The leadership cannot be about the leadership. It's got to be about the mission, or it's got to be about the community it's serving. And if you really hone in on those needs of the community, and you're brave enough to take some actions, then you can transform. If you're trying to hold on to the past, and you're trying to hold on to your bonus, and you're trying to hold on to, I don't really want to change that, I'm kind of comfortable right now, we're not going to get transformation. Complacency or things going well are the antithesis of why anybody would transform. You give people the choice to leave or to change, and they'll say, I don't want to change. My favorite person on this topic was William Bridges, and he tells the story of Moses being a transformational leader. So Moses convinces the people of Israel we're going to leave Egypt, and everybody says, we got to leave Egypt. It's terrible. It's a mess. We got to get out of here. Well, they all get out, and they get to the desert, and then they say, whose idea was it to leave? At least we had food there. Things were better. What a dumb idea. But what Moses is this transformational leader who continued to paint a picture of how things might be, and what we will put up with the sacrifice in order to achieve this great and worthy thing. That's what transformational leaders can do, because no leader can accomplish anything on their own. They can only accomplish it if they have people who follow and believe in that inspiration, and they themselves are willing to sacrifice for that great vision. That's a brave leader. That's a transformational leader.
I love that. Such great insights. Annette, this was such a great conversation. I so enjoyed speaking with you. It's very inspiring. Um, and to our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms. Thanks so much, Annette. It was so great speaking
Thank
with
you,
you.
Maria. You have a great day.
You too.